You've asked me to show you how to do CPR on an adult. Well, I'm going to do that for you, but watch the video all the way to the end because I'm going to show you 3 ways of doing it. 3 ways. How to do CPR using rescue breaths, so maybe it's someone you know very well. Someone that you don't want to give rescue breaths to. And then finally, I'm going to show you how to do CPR using an AED that you might have access to quite quickly. 3 CPR videos coming up for you now. CPR way number 1 with rescue breaths. So we check the air for danger. We see if they're responding to us by pressure or a loud noise. And we're going to open the airway by using a head tilt and chin lift. And we're looking, listening and feeling for breathing for 10 seconds. If they're not breathing, we're leaving the casualty, go and call 999 straight away. We then come back and remove what clothing we can. And we're going to start off with 30 compressions, and we're pushing down 5 to 6 centimeters in depth at the speed of 100-120 beats per minute. After 30 compressions, we then perform 2 rescue breaths with a head tilt chin lift, pinching the nose. And we want to see a gentle rise and fall of the chest. We then carry on 30 compressions and 2 rescue breaths, and just keep going until help comes. Let's do scenario number 2, not giving rescue breaths. Ready? Checking the area for danger. We're checking for response. Pushing on the shoulders, make a loud noise. We open the airway like we did before with a head tilt and chin lift. And we're looking and listening and feeling for normal breathing in 10 seconds. They should be breathing at least twice in this time. If they're not breathing normally, we are going to go and call the ambulance and get an AED if we have one nearby. We'll then return, remove the clothing that we can remove without scissors. And we begin compressions. And we're pushing down 5 to 6 centimeters in depth at the speed of 100 to 120 beats per minute. Now, because we don't need to count, because we're doing continuous compressions, this is when you can sing a song to yourself. Staying alive, staying alive. Oh, Nelly the elephant packed a trunk, went off to the circus. I'm not a very good singer, so I'm going to stop right there. But you get my drift. Just as long as you sing the song at the beat of 100 to 120 beats per minute, sing whatever song you would like. And now to show you CPR version 3 using an AED and a pocket mask. And also, let's do without a pocket mask. Ready? D for danger. We're looking, we're listening, we're smelling for things that could be dangerous. We'll see if they respond, we'll give them a bit of pressure on their shoulders, and maybe make a loud noise to see if they respond. There is no response. So then I do A for airway. I open the airway with a chin lift and a head tilt. And then I look, listen and feel for breathing for up to 10 seconds. So I'm looking at their chest rising and falling, I'm listening with my ear, and I'm trying to feel for breath on my cheek. Now this casualty is not breathing. So I leave the casualty now and I go and call the emergency medical services, and I make sure I grab the AED because there's one easily located that I can get in a few minutes. I return with the AED. The first thing I do is open it up and turn it on because it's going to talk to me. It's going to tell me exactly what to do. I'm then going to make sure I'm wearing the correct PPE. So I'm going to get my gloves on in this case. I'm then going to follow the instructions.
Apply pads to patient's bare chest.
The first thing I need to do is have a naked chest. So I need to remove the clothing off this casualty. So I'm going to unzip the jacket and then I'm going to use the scissors and place a cut at the top of the t-shirt. Might try and rip it. If that doesn't work, I will then keep cutting all the way down. Remember, neck down to belly. I'll make sure that they're not hairy, and if they were hairy, I need to shave them where the pads would go. And maybe dry them if they're very clammy or sweaty. I'll get the pads out of the packet. I will have a look at the pictures on the pads because they do show you where you need to put them. Unpeel them because they're a bit like plasters. Stick one on underneath the right clavicle and the other one underneath the left pectoral muscle. There should be a hand's width distance apart between the pads.
Plug in pads connector next to flashing light.
You will then plug it in to where it's flashing and you follow the rest of the instructions.
Analyzing heart rhythm. Do not touch the patient.
Making sure that everyone is standing back, nobody's touching a casualty, because if someone is touching them, reading will be incorrect. It will analyse your reading rather than the casualty's reading. Now remember, it's looking for a shockable rhythm.
Shock advised. Charging. Stay clear of patient.
Tell everyone to say back, so I say clear.
Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
Then begin CPR. So I'm doing 30 compressions with 2 rescue breaths. And don't forget, if you've got a pocket mask available, use it for the rescue breaths. So you don't need to put your mouth on their mouth. You just need to make a good seal, as you can see I'm demonstrating here. Don't forget to click that info card just above me there. That will show you how to do CPR during a COVID pandemic and the extra precautions that are being put into place. Don't forget to hit that subscribe button as well, so you don't miss out on any of our videos. And please comment below